hello there! Hello nurses and hello world! This is nurseniezl and welcome back to my channel! This video is solely for demonstration purposes only, as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden 10th edition. All information presented are public domain materials accessible to the relevant governing organization's website. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 test of competence or the Osce examination. This can be helpful materials for overseas nurses or internationally educated nurses to learn and adapt to the UK clinical setting and transition effectively into practice. And yes, today I'm going to show you how to demonstrate this very easy skill, the nasopharyngeal suctioning station. So this station have just been added last November 2022 and you have 8 minutes to finish this station. So nurses, candidates will be informed that ID check and consent has been done. So all you have to do is to perform the procedure. And like the other stations, since it's just 8 minutes, then the trolley is already been cleaned and all the equipments will be prepared for you. But of course, if it's not prepared on the trolley, then you have to take it one by one and put it in a clean trolley, okay? So even if that's the case, even if they're all prepared for you, as a nurse, you still need to check if they are clean and intact, and you have to check their expiry date. Okay, nurses, when you're inserting the nasopharyngeal tube inside the patient's nasopharynx, you have to be careful and monitor the patient, especially looking out for the distress signs, okay? Which we're gonna do and which we're gonna talk about later on. If that's the case, then you have to withdraw 1 centimeter and then apply the suction. So what am I talking about? We will soon do this skill, but in the meantime, I would ask you to please support my channel by giving this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more videos, then hit the notification bell. And another thing, if you have queries for me or if you want to ask me a question, then don't forget to hit the join button and become a member. So your question or your queries will be pop up to the top and I'll be able to answer, I'll be able to read and answer your question as soon as I can, alright? As soon as I can, because life is busy at the moment, okay? I will try my very best to do it. But in the meantime, we are on the road to the 10K subscribers. Yay! Thank you very much for your support. And if you're new here, welcome to the team. Let's start. Alright, so when you are already in this station, again, let me remind you, this is a performance or the skills, okay? You have to perform the procedure and you will be given 8 minutes, yeah? And so, the examiner will give you the scenario that looks like this. Of course, you don't need to check the ID anymore, okay? Everything else is done, including the consent. So just perform the procedure. But obviously, if the examiner didn't tell you that the ID check and consent has been done, you still have to do it. Just so in the careful side, okay? So the first thing I'm going to do is to wash my hands using the 6 steps of hand washing in accordance to the World Health Organization.
First, wet your hands. Obtain some soap with 5 backwards and forward stroke from palm to palm. Right palm over the left dorsum and vice versa. Fingers interlaced. Fingers interlocked. Rotational rubbing of the thumb and vice versa. Rotational rubbing of the palm with finger clasp. Rotational rubbing of the wrist. Now rinse it thoroughly with water. Pat it dry with clean towels and dispose it in the domestic bit.
Now that my hands are clean, I'm gonna prepare the articles needed for this station. Miss Examiner, is this trolley have been washed with soap and water and clean and then ready for use?
Yes, it's ready to use.
Okay, so I'm gonna prepare now the articles. Okay, kidney tray, sterile water, or soluble lubricant. Suction tube clean and intact. Expiration date is January 1st, 2030. Suction catheter, size 10, clean and intact. Expiration date is 1st of January 2030. So in your Osce exam, it should be size 10 or 12. Gauze, clean and intact. Expiration date is 11/2026. I got here the goggles, which is clean and intact. There's an expiration that I'm just gonna read it, 2040. So I got here the mask, clean and intact. So a pair of gloves, and an apron, which I'm gonna wear it now. And of course, we also have to check the suction machine. Or sometimes you're gonna have the portable suction machine in your exam, okay? Whichever is in it, please do practice both. So now that I've prepared everything, I'm ready to go now to my patient. So I'm just gonna gel my hands and let it dry for 30 seconds. Okay, taking now the trolley near the patient. Check scene safety, making sure to provide privacy and dignity for the patient. Let me just gel my hands and let it dry for 30 seconds. Hello, Miss A, are you alright?
Yeah, I'm okay.
Okay, so I am nurseniezl. I am here to perform a nasopharyngeal suctioning, if that's alright with you.
Yeah.
Okay, it's just that you had a major surgery and now you have a complication called pneumonia, and this chest infection is just compromising your airway. So we really have to make sure to perform this nasopharyngeal suctioning in order to clear your airway, if that's alright with you.
Okay.
Okay then. Are you comfortable?
I am.
Is it okay if I call you Miss A?
Yes.
Yeah, okay. Do you still want me to proceed?
Yes.
So this procedure requires you to be on an upright position. If that's alright with you, if you could just maintain this position, this is perfect for this procedure. Would you want some pillow at the back of your head so it will keep your head from moving forwards or backwards?
No, I think I'm okay now.
Okay then. Alright. So before I start this procedure, we're gonna arrange a hand signal, okay? So just in case you feel any distress in regards to me inserting this nasopharyngeal tube in your nasopharynx, please do raise your hand, okay? And when you do that, I will stop the procedure, okay?
Okay.
Alright then. So throughout this intervention, I will need to monitor your condition, okay? This includes your color, breathing pattern, respiratory rate, heart rate, secretions, and evidence of trauma, and generally any distress, okay? And this is by using the pre-suction baseline observation as per guidelines, alright? Is it okay if I start now?
Okay.
Okay. So let me just wear my mask. Just gonna wear my goggles. So I'm just gonna check your nostril, okay? Making sure that it's patent. Okay, by using this gauze, I'm gonna check your nostrils, okay? And another one. Nostril, do you want me to do the procedure?
Right nostril.
The right nostrils, okay? Okay, now I'm gonna get the suction tube and connect it to the suction. And we have to check if the suction machine or the suction on the wall is working. So I'm gonna connect this now. So I got my tubing and we have already checked it. Now I have to select an appropriate size and type of suction catheter. And it should be size 10 or 12. Okay, so I'm gonna open this. And attach it to the tube. There you go. So again, you have to do this without touching the key parts, okay? Ensure that you have to leave the catheter inside the protective cover. And I have to ensure that there is no contact between the catheter or any other things here apart from my gloved hand, okay? So this is my gloved hand. This gloved hand is the only one that can have a contact with the catheter. The rest is just right here, okay? Setting it to 12 to 20 kPa or 100 to 150. Let me just put the kidney tray near the patient in case the patient will vomit or feel nauseated. Lubricating the tip of the catheter. Okay. Miss A, I'm just gonna do your suctioning now if that's alright with you.
Okay.
So I'm gonna insert it gently. So I'm gonna gently insert it until the patient coughs or I feel any resistance. Okay, now I can feel the resistance. So I'm gonna withdraw 1 centimeter. And then I will start to apply suctioning with my thumb. Now I'm gonna slowly withdraw the catheter, maintaining the vacuum, applying continuous suctioning to avoid damaging structures. Now that we've done the suctioning, I'm gonna need to flush the tube using the sterile water. And then we have to repeat this procedure 2 to 3 times or as needed or as the patient can able to tolerate. Gently inserting the catheter into the nostril as the patient inhales until the patient coughs or if resistance is felt. Now withdraw 1 centimeter before applying the suction. We are applying suction by placing the thumb over the valve. Slowly withdraw and maintain a vacuum. Apply continuous suctioning to avoid damaging structures. So after this one, I have to remove it and throw it in the clinical waste bin. So I'm gonna get the remaining gauze and clean the patient's face, okay? So Miss A, I'm just gonna clean it. Miss A, are you comfortable?
I am.
Are you in any pain at all?
No, I'm not.
So do you feel relief after the procedure?
Oh, yes.
Okay, that's good. I'm glad to hear that. So this procedure is now done. I'm just gonna remove everything, okay?
Alright.
Alright. Okay, so I'm gonna remove everything that I've used and put it in the clinical waste bin. Okay, removing my gloves. And clean this one after the procedure. Okay, removing the mask. Put it in the clinical waste bin. Remove the apron. Again, clinical waste bin. Gel hands. And let it dry for 30 seconds. So Miss A, the procedure is now finished. Are you comfortable?
Yes, I am.
Okay, so I'm gonna go now. I just need to document everything that I've done here, and you felt relief as you mentioned a while ago. Alright, so I'm gonna go now, but in case of anything, if you need me, please. In case you need anything, here's the call bell. Please ring the bell, okay?
Okay.
Thank you very much for today. I'm gonna go now. Thank you.
Bye-bye. Thank you.
Okay, at this point, you can remove now the privacy and dignity that you provided, like opening the door, the windows, and the curtains. Gel your hands. I'm gonna wash this trolley with soap and water. I'm gonna wash my hands with soap and water using the steps of hand washing in accordance to the World Health Organization. And that's it, nurses. This is the end of this station. So how did you find it? It was easy, wasn't it? Again, you have to follow the marking criteria. If you want to know the marking criteria, please go ahead and go to the NMC website. I'm gonna put it on your screen. I hope you learned something for today. If you like this video, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell. Also, comment down below what other Osce videos you want me to do next, okay? To those of you who's got a question for me, please join the membership so I'll be able to see your question as soon as I can and reply as soon as I can, okay? That's part of your perks as a member. Also, as a member, you'll be able to see the videos first before anyone else, okay? That's you as channel members being exclusive. Again, this has been nurseniezl. See you on the next one. Bye!
And now for our shout out for today. Congratulations to you at Chua Evelyn 3866. Congratulations. Congratulations to at My Wong 2039. Well done. Well done to you too at Mona Lyrica 2567. Congratulations. Welcome to the team at Anushanish Sunny. I would like to welcome you to the team, Miriam Nyoka. Hello!